Hi, welcome to our channel. In this video, we will be covering phlegm and COVID. Is phlegm a hallmark sign of COVID infection? We have carefully created a series of videos about dealing with phlegm, a step-by-step approach. We highly recommend you to hit subscribe button and press the bell icon so that you may not miss our future videos. As the lethal COVID-19 coronavirus propagates around the globe, we know a sneeze, a cough, or simply touching a surface with the virus can spread the infection. What researchers don't know is exactly the role different compositions of mucus, the slimy substance on human tissue, play in the transmission and infection of coronaviruses. Nor do they know why some people known as super spreaders will spread the disease more than others. The most prominent symptoms of COVID are fever and fatigue, and you may feel like you have a cold or flu. Cough is present in about half of infected patients. Considering that COVID-19 irritates lung tissue, the cough is dry and persistent. It is accompanied with shortness of breath and muscle pain. As disease progresses, the lung tissue is filled with fluid and you may feel even more short of breath as your body struggles to get enough oxygen. Phlegm is a type of mucus produced in the lungs and lower respiratory tract. It is most noticeable when a person is acutely sick or has a long-standing health condition. Mucus forms a protective lining in certain parts of the body, even when a person is well. A wet cough brings up phlegm from the lower respiratory tract, the lungs and lower airways, as opposed to nose and throat, into the mouth. The wet sound is caused by the fluid in the airways and can be accompanied by a wheezing sound when breathing in. The lower airways have more secretory glands than throat, which is why lower respiratory tract infections cause a wet cough. A dry cough doesn't produce phlegm. It usually starts at the back of the throat and produces a barking or coarse sound. A dry cough does not clear airways, so sufferers often describe it as an unsatisfactory cough. Nose and throat infections cause irritation to those areas and produce a hacking dry cough with sore throat. These types of cough are often seen in flu or cold. Sometimes a cough can start off dry but eventually turn wet. For example, the lung infection pneumonia often begins with a dry cough that's sometimes painful and can cause progressive shortness of breath. As infection progresses, the lung air sacs, alveoli, can fill up with inflammatory secretions such as lung tissue fluid and blood, and then the cough will become wet. At this stage, sputum becomes frothy and blood-tinged. Lastly, we can say phlegm production is not the hallmark sign of COVID infection. However, as disease progresses, mucus accumulation in lungs can cause severe shortness of breath. In our next video, we will be discussing, in detail, phlegm removal, a step-by-step approach, so make sure to subscribe our channel and hit the bell icon so that you may not miss any of our future videos. We will be uploading videos on a regular basis. Take good care of yourself, stay safe, stay healthy always. Leave a comment and hit the like button. This will boost our efforts. Thanks in advance.